Hi friends, happy to see you all. I hope everyone are been fine. So welcome to the Crack Nursing Licensure Exam channel. So previously in our videos we were been discussing as a part wise based upon the test taking strategies. What are all the strategies? Usually the each examination in each way of nursing examination, how they will be making the question answers, we have been seen with the strategies, different strategies. So the remaining 3 strategies is there. We have to finish with the 3 point of strategy. So with this part we will be finishing this with this test taking strategies will be finished with this video. So this is like a series of a part 5 part is there. So the previous 4 part I will be attaching below with the description. So please you can go through the previous 4 videos, so that way you can go through once with the previous strategies. So the final 3 strategies what we are going to discuss today means the first strategy is the example of umbrella option. This is like a universal standard precaution. Based upon the universal standard precautions, they can make questions for you to, and they will be asking you to answer it. So example they have given here, the client is admitted and he's been diagnosed with the urethritis which has been caused by the chlamydial infection. The nurse is assigned to the client and you are been understanding that which precaution are being necessary to prevent the contraction of the infection during the care. So they have already given the correct answer also, you can just see that. So even though you must know how they can ask this. So with the options like enteric precaution, second option contact precaution, third option standard precaution, fourth option wearing gloves and mask. So whenever you are going with the sexually transmitted infections, whenever you are taking care of those clients, those are having with the sexually infection cases, easily we will be getting contracted with that cases. So we have to use a proper precautionary methods. So as we are having the universal as a guidelines which has been given based upon the standards. So even with the infectious control team also they have given us a proper guidelines for this. So we must go with the standard precaution. So that is the correct answer here. So next with the thing that is extra information with this question I have kept here, that is a urethritis. Usually urethritis is a condition where the infection you may be seen in the urethra. Even the infections can be happens in the bladder also. That is these are all the types is called a UTA, urinary tract infections types. And the urethritis usually it can be caused by 2 ways. One is like sexually transmitted infection and another type is a non-sexually transmitted infection. So the normal cases you may be seen like urinary tract infection because of non-sexually transmitted infection, even because of bacterial prostatitis, urethral stricture, phimosis, instrumentation of urethra, even with the chemical irritations, with the tumor, congenital anomalies. So these are all may be causing it. And through this way also you will be getting the urethritis. Sometimes through the sexually transmitted infections also the patient will have those are having with the sexually like STDs. There are 2 types you can see under the sexually transmitted infection, like gonococcal urethritis is one type and another one is a non-gonococcal type of urethritis. So under the non-gonococcal type is like a chlamydial, and because of mycoplasma, trichomonas, even herpes simplex virus also comes under this, and even adenoviruses also. So whenever you are seeing this type of urethritis cases, they will be having symptoms like urethral discharges, itching, tingling of their penis areas and in the urethra, pain also they will be feeling more during the urination time, burning sensation also will be there, and lymph nodes. You can identify the lymph nodes also nearby that groin region and nearby that perineal areas. So they will be having swollen in that part also because of this infection. So you may know this standard precaution. So from the time that is a steps of processes from the hand washing till the removal of all the that is a precautionary items which you have been wearing like gloves, mask and gowning, everything. So there is a steps of procedure. So from the donning till the removal, that is called a standard precautionary methods. Everything you will be wearing here. So like goggles and gloves and mask and even the surgical mask and even like a respiratory mask also, and for the protection like a double gloving will be there, and the gowning, and even the protectors, the shoe protectors also you will be wearing. So these are all the things you will be using it in the standard precaution. You can just go through once in the standard precautionary methods what are all the processes that is being usually followed. So next strategy is that is using guidelines for delegating and for assignment making. So whenever you are being as a nurse, so whenever they are been assessing you, so they will be assessing your management skills also. As a nurses, we will be becoming as a registered nurses, we will be having one more job, that is a responsibilities like managing care. So as an example, you can see here how we will be delegating and how we will be assignment. We will be making an assignment for your staffs, so those who have been under you in your ward. And here one of the example, the nurse as a in charge of a long-term care facility, you have been planning the client's assignment for the day. Which client should be assignment to the unlicensed assistant personnel? As we have been saying that nursing assistants. So which patient you will be assigning to the particular unlicensed nurse? So they have given 4 clients here. So among these 4, for whom you will be assigning, for which patient you will be assigning to that unlicensed assistant personnel. One client, the first patient is on strict bed rest. Second patient is with dyspnea who is receiving oxygen therapy. The third patient is being scheduled for the transfer to the hospital for the surgery. The fourth patient, he is having a gastrostomy tube, and through which the tube feeding has to be given every 4th hourly. So these are all the 4 cases they have given for you. You have to choose one from among this. So whenever you are taking care of the dyspnea, gastrostomy tube with the feeding cases, even in the transfer techniques also, usually these 3 will be followed by the registered nurses only. Very well. Even in the transfer cases also to the surgery, we have to give a proper handover to them, to the OT nurse. So these are all usually followed by the registered nurses, but the easiest job among this is the strict bed rest. That you have to watch over for the strict bed rest case. That will be easiest to work. So whenever you have been allotting to the unlicensed assistant personnel, so always you have to choose the non-invasive procedures and non-invasive tasks to be given for the unlicensed assistant personnels like nursing assistants. So the first option will be the right one here. So the next, the final strategy is the answering the pharmacological question. So they will be asking you the like side effects, and with adverse effect they can ask you even the drug interaction reaction or the toxicity reactions also, even the functions, and with the even the uses of those drugs. Example they have given, quinolapril hydrochloride is being prescribed as adjunctive therapy in the treatment of heart failure. After administering the first dose, the nurse should monitor which item as a priority. So the 4 things you have to check for. Among this, which one you will be checking here as a priority one for this patient who is taking quinolapril hydrochloride. You may know this quinolapril hydrochloride is one of the drug example of AC inhibitors, angiotensin converting enzyme. So among this 4, which one you will be giving a priority to assess, whether you will check weight or urine output or lung sounds or blood pressure. So this is one of the AC inhibitors. Usually this has been given to control the BP, that is a high BP. Usually in the hypertension cases they will be giving this, even in the stroke also, heart attack cases, in the kidney problems, even in the heart failure cases also, to control the BP, high BP, they will be giving this. So when we are giving this, we have to monitor the BP, because if you are giving this, if this drug happens like overdose, so the BP will be gets lowered more than the normal, like hypotension can happen. So we have to check the BP often when we are taking this drug, and we need to monitor the BP often in between the treatment. Not only with the BP change, the patient will have the side effects like headache, dizziness, fatigue, coughing, nausea, vomiting, stomach pain, chest pain, and even the BP also will be lowered here. So these are all the usually side effects and adverse effect usually happens here with this drug. So when I am going with this type of AC inhibitors type, as we have seen this name, quinolapril, the name of these drugs, all the examples you can see the word, the suffix means the end of that word. The last 3 or 4 letters will be ending like pril. So with that identification, you can easily identify the drugs which are being coming under the AC inhibitors. So this is an example of like answering pharmacological questions. So till now we have discussed many strategies. So we have discussed like more than 10 strategies also. So please go through the previous slides, previous videos which I have been posted already, which I have been updated already in the YouTube, this same channel. crack nursing licensure exam. So I will be attaching those link also with each and every part of the video below this video also. I will be attaching those link in the description. Please go through the previous videos and even this also. This is the part 5. So I will be making these videos as a as a list of videos, and please subscribe to my channel, and you will be getting the future videos as also as an update. You will be getting on every videos which I have been uploaded. So you can easily get the points, and which are all very important points for the NCLEX exam, for the DHA, and with the MOH and HAAD, for all the prometric exams for the nurses. So this will be very helpful for the nurses to go through their subjects and how we have to get prepared for your nursing examination, that is a licensure examination. So this will be the very helpful video for you. This will be very helpful for you, and get ready, and all the best for your examination. Crack well in your nursing examination. So please subscribe to my channel, and please like this video also. Thank you. Bye.